Hello guys, welcome to the another videos on my YouTube channel Medico Sumitro. So today I will discuss detailedly about the histamines and antihistamines. So just be with me, and those are new on my YouTube channel, please subscribe this channel and don't forget to press the notification bell icon. Once again, welcome back to this video. So as I told that today we'll have discussion about the histamines and antihistamines. Okay. So before that we have to discuss, before the discussions of the antihistamines, we need to know what is the histamines, right? So histamines, these are the mediators. Those are mainly present in a those are mainly present in the mast cells. Okay. So the mast cells are the cells those are present in our different body or vital organ, different vital organs, like in our skin or in our liver, in our lungs, in our gastric mucosa, in our placenta. So in different vital organs we can see the presence of the mast cells. Okay. So because of the presence of the mast cells, the mast cells are the one and only cells, those are the these are the responsible for the different um, secretions of the different receptors or the mediators, and under that the mediators which is coming like histamines. Okay. Suppose see, that is the mast cells. Okay. So that is the mast cells. Whenever the antigen antibody reactions or due to different kinds of food like crab, fish, or different vegetables also. So whenever the suppose one person is allergic to some food. Okay. So that person's, whenever that person is eating that kind of food, he's we can see the releasement of the histamine. Okay. We can see the releasement of the histamine from the mast cell. Okay. So after the releasing of the histamines because of the allergic reactions towards that food of this person's, so we can see the symptoms like itching, urticaria. Urticaria means the itching sensations on the place over the skin due to the any kinds of food substances. Okay. So urticaria, flushing, hypotension means the low BP, tachycardia means the rapid breathing, or bronchospasm means the spasm, means the contractions of the bronchi. Okay. And angioedema means the like heart will be edimated. Okay. So these are the different symptoms we can see because of the releasement of the histamines. Okay. So hope so you understood. So next we'll see the histamine. So there are two different receptor like H1 receptor and H2 receptor. Okay. So that, so today we'll have the discussions, or today we'll have the drugs against the H1 receptors, because the antihistamines are the drugs, or the drugs like those are the responsible for blocking the H1 receptors. Okay. So if the H1 receptor blocked, so what are all will be blocked, like the smooth muscle contractions will be blocked, and we cannot see also the increasement of the capillary permeability. So permeability means the allowances. Okay. So what is the meaning of the permeability? Means the allowances. Allowances means it won't be, so the capillary permeability means the capillary allowances. Okay. So it can be allow different substances or different RBC or blood circulations. For blood circulations, different substances are necessary, right, like oxygens or different nutrients products also. So that permeability will be increasing whenever the H1 receptor is releasing from the histamine. Okay. So if we block the H1 receptor, we cannot see the smooth muscle contractions, and along with that also we cannot see the increasement of the capillary permeability. Okay. So let's see. Okay. I think you all understood, right, like how the releasement of the histamine occurring, and because of the releasement of the histamine what are the symptoms of are coming, right, like itching, urticaria, and flushing, hypotension, tachycardia, bronchospasm, and angioedema. Okay. So that is all about the histamines, and next we'll see what is the H1 receptor antagonist and the blockers, H1 blockers. So there are the two classified or the two generation drugs like first generation and second generation. So for preventing these allergic conditions, so different in our daily life or daily basis life, in our general life or daily life, so every day so many people are suffering like due to the allergic substances like antigen antibody reactions and hypersensitivity reactions. Okay, so for preventing all those things we need to treat by giving the first generation drug and second generation drug. So under the first generation drug, so these are the two classified drugs, both are mainly blocking the H1 receptor, not blocking the H2 receptor. So I forgot one thing, like H2 receptor, whenever the H2 receptor is releasing from the histamine, so the H2 receptor is the responsible for the increasement of the gastric acid secretions. So that is the H2 receptor blocking is another classified drug like NSAIDs. Okay, so we can prevent by the increasement of gastric acid secretions by giving the NSAIDs. Okay, so that is different topic, I have told in previous video. But today we'll have the discussions about the how to block the H1 receptors blockers, how to block the H1 receptors, and how to control the itching or allergic reactions. Okay, so there are two classifications drugs like first generation and second generation. Under the first generation drugs we will have like diphenhydramine. Okay, diphenhydramine. So all first generation drugs having like the same dose like 50 to 25 to 50 mg. Okay, 25 to 50 mg, 25 to 50 mg all drugs maximum. So the all first generation drugs having the doses of like 25 to 50 mg. Okay, so let's see what are the first generation drugs like diphenhydramine. It is also called as in our daily life like Benadryl. Okay, and dimenhydrinate, promethazine, cinnarizine, meclizine, pheniramine like Avil. We are know, as you all know, like Avil, it is a anti-allergic drug, right? So the Avil, which are known as a Avil, this branded name is like pheniramine. Okay, pheniramine. So pheniramine, meclizine, cinnarizine, promethazine, dimenhydrinate, and diphenhydramine. So these are the first generation drug. And next we'll see what is the second generation drug like cetirizine, 10 mg orally, and levocetirizine 10 mg. So loratadine and ivestine. Okay, so these are the different second generated drug. So I will show you that the second generation drug like levocetirizine. Okay, so see, that is the levocetirizine. Okay, so that is the packet. See, levocetirizine, can you see? Okay, see that levocetirizine. Okay, so that is also in every houses it is available, I think so. So in every houses the levocetirizine means the anti-allergic drug, it is available. Okay, in every house. So that is about the first generation drug and second generation drugs. Let's see what is the mechanism of actions of the first generation drug or H1 blockers. So if you'll give the H1 blockers, if you'll give the H1 blockers, okay, so that is the H1 blockers means the H1 receptor blockers. So that is the histamine antagonist. Okay, it is blocking the H1 receptor, and this is also called as a antihistamines. So which is histamine antagonist, that is only antihistamines. These all are acting on the H1 receptor. Okay, so that is only the mechanism of actions of the H1 blockers, means which is calling as a antihistamine and histamine antagonist, both are same, both are giving block the H1 receptors. Okay, so that is about the classifications. Okay, and next we'll see the uses of the first generation drugs. Okay, what is the uses of the first generation drugs, and I will tell you what is the how can you remember easily the uses of the first generation drugs, the easy trick. Okay, so let's see the allergic diseases. So uses of the first generation drugs. So if you'll use the first generation drug, okay, so there will be certain conditions like pruritus, like okay, or skin irritations, pruritus, inflammations of the skin, and urticaria due to the allergic substances, means the due to consumptions of the food materials, allergic food materials. So urticaria will be seen. Skin itching and dermatitis, inflammations of the skin, and rhinitis, conjunctivitis. So these are the different symptoms seen um, due to the uses of the first generation drug. And next we'll see the common cold. Okay, so these drugs produce symptomatic relief by their sedative and anticholinergic effects. So whenever we are using the first generation drugs like diphenhydramine, dimenhydratine, okay, meclizine, cinerizine, okay, promethine, so different first generation drugs, if we'll use, so we can see their sedation effect, means the drowsiness. The persons will feel who will take the drug, he will feel so sedation, drowsiness, feeling so sleepy. So these are the different synonyms to the sedation. And anticholinergic effects also, we can see the common cold. So to reduce the common cold, we can see anticholinergic effects also. And like for pre-anesthetic medications, for as a pre-anesthetic medications also, we are using the first generation drug like promethazine. So that is also one of the uses of the first generation drug. And next we'll see the Parkinsonism. So what is Parkinsonism? I will make a video on about the Parkinsonism. So today I'll say only a small introduction like Parkinsonism. What is the Parkinsonism? So Parkinsonism is a conditions of an human being whenever the dopamine and acetylcholine imbalances occur. Okay, so whenever the imbalances occur between the dopamine and acetylcholine, then only we can see the imbalances of the, and then only we can see the conditions cause Parkinsonism. So whenever the Parkinsonism occur, the symptoms like tremoring, rigidity, so these are the different symptoms occurring due to the Parkinsonism. Okay, so if we'll use the first generation drug of the histamine, antihistamine or H1 receptor blocker, so we can see the promethazine, diphenhydramine. If we'll use the diphenhydramine or promethazine, we can easily block the symptoms of the Parkinsonism like rigidity, tremoring. Okay, so we can prevent the symptoms, so thereby we can also prevent or suppress the Parkinsonism. Okay, and next we'll see the antiemetic. So one and only most important uses of the antihistamines of first generation drug like antiemetic for preventing nausea and vomiting conditions. So we are preferring the antiemetic drug as a promethazine, diphenhydramine. Okay, so dimenhydrinate treat motion sickness. So one of so in the first generation drug, the another drug like dimenhydrinate. Okay, so it is also treating the motion sickness. What is the motion sickness? So the motion sickness is the whenever the um, traveling somewhere one person's, so then the traveling sickness like nausea, due to the traveling the person's is feeling nausea, vomit. Okay, so that is called motion sickness. So for preventing that motion sickness, we are using the dimenhydrinate. So that's what we are calling as a antiemetic drug as a dimenhydrinate. Okay, and control vomiting due to the cancer chemotherapy and radiation. So it is also controlling the vomiting which is occur due to the chemotherapy, cancer chemotherapy and radiations. So because of the when we are treating the cancer by giving the chemotherapy and radiations therapy. Okay, so then also we can see the presence over the presence over the persons the vomiting. So for treating the vomiting, we are using the antiemetic drug as a antiemetic drug like dimenhydrinate. Okay, or first generation drugs. Okay, and next we'll see the control mild blood transfusions. So as I told in the histamine, H1 receptor, see wait, so let me show. So I have told in here, so it is H1 receptor is the responsible for the increasing capillary permeability. Okay, so mean it is allowing so many substances or so many materials which is the which is responsible for the blood transfusion, not blood transfusion, like blood circulations. Okay, so either it can be a nutrients or glucose or the energy, glucose, nutrients, so different oxygens, so different elements it is allowing. Okay, so give if you'll give the first generation drug, so the blood transfusions will be mild. It is controlling the blood transfusion from the more mild, very mild. Okay, and then see the vertigo. I will tell what is the vertigo. Okay, so vertigo, so it is controlling the vertigo by using of like cinerizine, meclizine. Okay, so these are the different first generation drug we are using for the treating of the vertigo. Okay, so these are the so confusing, right? So how to remember is the first generation drugs uses. Okay, so like a square p square b v c, a square p square b v c. Okay, so you can remember like that also, a square p square b v c. A square means, so a square, a and a for allergic diseases, a for what is that, anti-emetic. Okay, p square means p for parkinsonism, p for pre-anesthetic medications, b for blood transfusion. Okay, b for blood transfusions, v for vertigo, c for common cold. Okay, so in that way also you can remember so easily. Okay, so that is the uses of the first generation drug, and next we'll see what are the second generation drugs uses and what is the anti-vertigo, means the vertigo. So the second generation of the H1 blockers, like it's not preferring any kinds of antinergic effect. Like in first generation drugs, it's having the cholinergic effects, anticholinergic effects, and sedations. So because of these all those things, we are preventing the common cold. Okay, by using the promethazine. So it's not having any kinds of anticholinergic effects, and also it's lacking the antiemetic effect. So the second generation drug, second generation H1 blockers, it doesn't contain any kinds of emetics, emetic effect, and it is also minimizing the minimizing the number of the drowsiness, means the sedating effect will be less in case of the second generation H1 blockers. Okay, and next we'll see what is the uses. So it is blocking various allergies like rhinitis, dermatitis. In case of the first generation drugs also we can see all those symptoms. Okay, these all the first generation drugs also preventing these type of things, rhinitis, dermatitis, and urticaria. Okay, different conjunctivitis, eczema is also one thing, like skin irritations. Okay, and drug and food allergies, all these things are blocking uses. So I have told you the cetirizine is more commonly used in second generation drugs. So in general days, in our daily life, the most uses drug of the second generation drug is like levocetirizine or cetirizine. Okay, so that is all about the uses. And let's see the vertigo. What is the vertigo? So vertigo is a sensation of the rotations or movement of one's self or one's surrounding in any plane or in any place. So vertigo is the sensations of the rotation or movement. Suppose you are standing, many times it happens with everyone. Suppose that person is standing here. Okay, so in case of the vertigo, the persons will feel the sensations of the movement, means his head is not completely working properly. He's thinking like he's moving, or his surrounding is also moving. He's standing and he's always moving. Okay, so that is happen in case of the vertigo, means the sensations of the rotation or movement of one's self. Understood? So how to treat the vertigo? I have told in the first generation drugs uses. So it is treating or it is controlling the vertigo, right? So that is all about the vertigo. And how to treat the vertigo? By using anti-vertigo drugs like cinerizine, like first generation drugs, promethazine, diphenhydramine, acetazolamide. I told in the diuretics drugs, right? Like carbonic anhydrase inhibitors, right? So that is one of antidiuretic drug. Okay, acetazolamide. Thiazides also anti-diuretic drugs. Furosemide also one of the anti-emetic loop diuretics. Okay, so diazepam. So different drugs are using. Okay, so these are the drugs for controlling the anti for controlling the vertigo. Okay, so that is all about the topic. Let's recap. So histamines mainly present, histamine mainly releasing from the mast cells, which is present in our and skin, liver, lungs, gastric mucosa, placenta. Okay, gastric mucosa, placenta. So suppose that is the mast cell, and whenever the antigen antibody reactions occur, or due to the consumption of the food, allergic foods like crab, fish or vegetables, so because of these consumptions we can see the release of the histamine, and because of the release of the histamine we can see the presence of itching, urticaria, flushing, hypotension, tachycardia, bronchospasm, and angioedema. Okay, so these all are the symptoms because of the release of the histamine. Okay, so if the histamine is releasing, so the two receptor is working on that, like H1 receptor and H2 receptor. Because of the presence of the H1 receptor we can see the smooth muscle contractions occurring, and also you can see the increase in the capillary permeability. So it is allowing different materials or different substances in the blood circulations. It is allowing, that is called permeability. Okay, so the permeability, capillary permeability will be increased because of the releasement of the H1 receptor. Understood? So next, see the two generation H1 blockers drugs or antihistamines, like first generation, second generation. Okay, under the first generation we will have that diphenhydramine, dimenhydrinate, promethazine, cinnarizine, meclizine, phenoramine. Okay, it is also known as the evil, which is using in our daily life as a evil. And all first generation drugs having the doses of like 25 to 50 mg. And next see we'll see like second generation we have seen like cetirizine, levocetirizine. So cetirizine is the most commonly used drug in our daily life for treating the allergy. Okay, and loratadine. So these are not so useful, but these are the comes under the second generation drug. And next see will the mechanism of actions of the H1 blockers. So how it is the mechanism of actions, how it is occurring, like which is we are calling like histamine antagonist or antihistamine. So both are same, both are blocking the H1 receptors, so we cannot see the H1 receptors works. So H1 receptor is working like for muscle contractions and increasing the capillary permeability. It cannot be occur because of the using of the histamine antagonist. Next you will see what is the second generation drug. Like first generation uses, like it is allergic diseases, for treating allergic diseases like pruritus, urticaria, dermatitis. Okay, rhinitis, conjunctivitis, different. And for treating also common cold, sedations, anticholinergic effects. Okay, so by the sedations and anticholinergic effects it is providing relief from the common cold by using the first generation drug. And like pre-anesthetic medications, promethazine we are using, and the Parkinsonism, for treating the Parkinsonism also we are using promethazine, diphenhydramine. Okay, and also treating the emetics, means the nausea vomiting, for treating the nausea vomiting we are using the antiemetics like promethazine, diphenhydramine. Okay, and for treating dihydrogenate. Understood? So and vomiting is used because of the cancer chemotherapy and radiation. For treating all those things also we are using antiemetic drug like promethazine and diphenhydramine. Understood? And next we'll see the it is also controlling the blood transfusion, mild blood transfusion, and you also control vertigo. We are using cinnarizine and meclizine. Okay, and I have told also the how to remember the first generation drugs is square, p square, bvc. A for allergic diseases, A for antiemetic, and P for pre-anesthetic, and P for Parkinsonism, V for mild blood transfusion, V for vertigo, C for common cold. That is also, these are all the uses of the first generation drugs. And next see will the what are the uses of the second generation H1 blockers. Like it is blocking the allergic disorders like rhinitis, dermatitis, conjunctivitis, urticaria, eczema, drug and food allergies. Okay, so in that we are using more preferably like cetirizine. Okay, And I have told also about the vertigo. What is the vertigo? Vertigo is the sensations of the rotations or movement of the one's self. Okay, means the persons will feel like his surrounding area like moving. Okay, so that is the sensation, that is called vertigo. And because of that also we can see the appearance or arisement of the nausea and vomiting. For treating the vertigo we are using some antivertigo drugs like promethazine, diphenhydramine. Okay, and like different diuretics also we are using like acetazolamide, thiazides. Okay, acetazolamide, thiazides, furosemides, diazepam, different you are drugs using. Okay, so that is all about the topic. So I think you all have understood. If you're having any kinds of doubt means you can ask me questions below to the comment sections. So once again I am telling, like, those are new on my YouTube channel, please subscribe this channel and don't forget to press the notification bell icon. And if you like this video, please do likes and share with your friends. After that, stay safe, stay happy. Thank you.